All right. Hello, everyone. Good afternoon, and welcome to the Greenway and Klara webinar. Thank you for joining us today. My name is Courtney Ward, and I am one of the marketing managers here at Greenway. I'm joined today by Francesca Belmer, Director of CX Marketing, and Pete Fenton, Regional Sales Manager at Klara. Before we begin, I'd like to take a couple moments to ensure that you have a positive experience during today's virtual event. To start off, this presentation is being recorded. We'll make the recording and presentation slides available to your practice via My Greenway after the presentation has finished. You can find a copy of the presentation slides in the resources section of your On24 console. And if you would like to check out the marketplace listing for Klara, you can click on the image within the corner on your right, and it'll take you over to their listing and you can request a demo there. Feel free to play around with the webinar dashboard. You can move around your slides, expand and minimize different sections, and find more tools in the On24 console at the bottom of the screen. In this area, you will also find our post-event survey. We ask that you please take a few moments to fill this out after today's presentation. It helps us tremendously when planning out the future roadmap as well as future events. If you prefer to listen to the presentation via phone, you can log into this session by using your join link on your phone. This will allow you to experience the same presentation just on a different device. Another quick tip, if you experience any audio or connectivity issues during the presentation, please press F5 or refresh your screen. Lastly, we highly encourage you to submit questions that you may have by using the Q&A tool, which we will answer at the end of this presentation. Now over to you, Francesca and Pete.
Awesome. Thank you so much for that, Courtney. So like she said, my name is Francesca Belmer. I'm the Director of Customer Experience Marketing here at Klara, which is really just a fancy way to say that I head up our product and customer marketing efforts here at Klara. But my better half is Pete Fenton, so I will let him introduce himself.
Hi, Pete Fenton. I'm one of the regional sales managers at Klara. I've been in healthcare sales for about 10 years, the first few in durable medical equipment, and the last 7 or 8 in patient engagement solutions. So definitely a little bit of experience in the marketplace selling to all different folks from your one doctor practice all the way up to major enterprise systems like your NYUs and MUSCs and large healthcare groups like that. Excited to chat about Klara and Greenway and just some of the industry things around patient communication that are going on today.
Awesome. Thank you, Pete. So quick agenda overview. So you know what to expect in the next hour or 45 minutes or so. So we're going to be spending about 30 to 40 minutes discussing communication challenges that many medical practices are facing today and some strategies to solve for those challenges with technology. So we're also going to take a look at Klara's interface with Greenway Health, which we're very excited about, and how the interface seamlessly connects patients with providers. And then lastly, we'll go ahead and take a look into the future of healthcare communication and the ways that artificial intelligence and machine learning models can really enable staff to support more patients at scale. Right, so the last 10 minutes will be an audience Q&A, maybe 10, 15 minutes to give you guys some time. So if you do have a question, again, type those in that Q&A box right there, and we will get to as many as we can at the end of the presentation. But without further ado, we can go ahead and jump right in. So first, we are going to look at some of the top communication challenges that the healthcare industry is experiencing today and how they do affect patient engagement overall. So with that, when it comes to patient complaints, fun fact, in the healthcare space, you'll see that only 4% of patients' complaints are about clinical care, and that 96% are actually more so based around customer service and communication. Now, why is that true? Because, unfortunately, communication in healthcare today is broken. There are so many steps involved in the patient journey, from booking an appointment to getting pre-visit instructions to submitting insurance information. The list, as I'm sure I'm preaching to the choir, the list goes on and on. So with so many touch points, there is so much room for error, especially when this communication takes place solely through the phone. And we have a few stats to dive into deeper here into the issues of phones specifically for practices. So as you can see on this slide, about 42% of patients have said that the effort that it takes to connect with their providers is the biggest barrier to communication. And that 6.9% is the average call abandonment rate in the healthcare industry. Now, if you get, 1,000 calls in a day, if you're a larger practice, 6.9% is huge. And then 38.1% of patients who missed an appointment said that if they had received a text message reminding them of that appointment, it could have prevented that missed appointment altogether. So, Pete, I want to kind of ask a question to you for a moment. Can you kind of tell us a little bit about the specific communication challenges that you hear when you're talking to medical practices?
Yeah, for sure, Francesca. I mean, the first thing that comes to mind really, and a lot of the folks that I've been speaking with over the last year, the term merry-go-round comes to mind. It seems like there's this never-ending continuation of phone calls, and you really don't go anywhere. There's a lot of movement and a lot of busy work, but really no desired end result. When I talk to nurses trying to report a lab result or a scheduler trying to get somebody on the calendar, and it impacts the practice a number of different ways, from both the practice side and the patient side, to where from a care providing perspective, there's so many screenings and proactive things that we're trying to get patients to adopt to better serve them and catch things earlier so they're easily treatable. So that provides better patient experience from the practice side, making sure that they are providing the high level of care. And I just hear a lot of frustration around simply being able to get in touch with somebody to relay this communication. And then the big number that jumps out to me on this slide is the 6.9% abandonment rate. So for those who don't or aren't familiar with that term, essentially somebody calls your practice, they get frustrated, they can't get in touch with somebody, whether they're on hold or they get bounced around a call queue, and they end up hanging up. This has a lot of different impacts from the face level, for what we're hearing from patients, obviously for a poor patient experience. But when you tie it back to the practice, there's a lot of impact down the line, specifically revenue-based for the financial folks and operations folks, where every person that doesn't get in touch with your practice, could be considered a new patient opportunity. And in certain practices, like I spoke to pediatric practice, they constantly have to refill their funnel of patients, right? Because they age out of a practice, or an OBGYN practice that, if they're doing mostly labor and delivery stuff, once families are done having children, then they have to replace them with new people. So I think it just creates a lot of frustration around the phones, where a lot of front offices are really understaffed. That's a really big commonality that I think is really leading to some of these statistics. So we try to use Klara to help mitigate and provide alternative avenues to get in touch with the practice to alleviate the dropped call and abandonment rate, and eliminate a lot of the frustration around just simply getting in touch with either a patient from the practice end or a patient reaching out to the practice for any number of reasons, whether it's scheduling, billing, getting a lab result, or for the last few years, getting a COVID result to be able to return back to work, travel to see friends and family, or for a child to be able to go back to school. So we're definitely seeing a lot of those trends and hoping that Klara can alleviate some of it.
Yeah, absolutely. And then with so many of the communication challenges that are facing practices, I also kind of want to note for a second that unfortunately the healthcare industry is one that doesn't always stay on top of the latest technology. And many practices today are still using paper forms, fax machines. They're playing that phone tag that you talked about, that merry-go-round, and using filing cabinets even to store paperwork and so on. So, Pete, have you noticed in your conversations, you got a ton of experience in this, are you running into practices that are still using that antiquated type of technology? And on the flip side, do you find that they're resistant to adopting new technology right now?
Yes. Certain little parts of this image really give me personal heartburn. My days of durable medical equipment, a lot of the communication was fax-based, coming out of nurses' stations and offices to order equipment. And oftentimes I'd be physically standing there feeding stuff through a fax machine to be sent to my phone, only to see a confirmation on the practice end and it never come through on my end. It just leads to a lot of gaps in care where things get delayed just because of inefficiencies around antiquated technology. The paper forms, thankfully, I think are becoming less and less frequent. But I think something that resonated, Francesca, with a little bit of comfortable with what we've been doing for the last 30 years. It's hard to change process in the practice, especially when so many people are short-staffed. They're juggling so many tasks. Taking on a new technology can oftentimes seem like a real bear. I know the initial technology adoptions were all EHRs and PM systems, and going from completely paper to completely technological is obviously a big jump. So a little resistance, but I think people are warming up to it more and more as they see that being digitized does save a lot of time and energy around like simply scanning and uploading a document, and the busy practices like you'd mentioned earlier that are getting thousands of phone calls a day, that are seeing hundreds and thousands of patients throughout the day. Those seconds and minutes add up to hours over the course of the week. And, if we can get somebody home a little earlier instead of doing something like that, or giving them an extra 15 minutes to be able to have a cup of coffee or go for a walk around the building for a little mental break, I think that's invaluable. And then pagers, I laugh when I say I had a beeper in high school. So I haven't come across pagers recently, but definitely the paper forms and fax machines are still a little surprising to me that so many people are still using them. But I definitely see people are being more and more open to the technology as, we walk them through the benefits versus, the challenges of onboarding and implementing something very new when we've been doing something the same way for so long.
Yeah, that I couldn't agree more. And, that's why, at Klara, we do really believe that it's time to change the way that practices, operate, so that you can, as healthcare professionals, get back to doing what you love, and not getting bogged down by these manual tasks, that are fairly redundant with each patient that you encounter. So if we go into our next section here, we're going to review some ways that your medical practice can reduce those communication barriers and, as a result, increase patient access overall. So getting into that, when it comes to making healthcare accessible for all patients, we believe, and I genuinely mean that when I say it, everyone at Klara truly believes it, that it starts by solving today's fragmented communication between patients and practices and their providers. So when it comes down to it, we're all patients, and we want more ownership over our own healthcare journeys.
Yeah, and Francesca, if we remember the previous slide, that's all tangled with all the calls and voicemails and callbacks and staff communication and patient communication. It's really clear that patients and providers are oftentimes looking for the exact same thing, which is really simplicity and transparency throughout their healthcare experience. This is definitely where Klara can help by removing that complicated, mixed up process and connecting your patients directly with the practice and providers with as least amount of friction as possible.
Yeah, absolutely. And not only do we allow patients to communicate on the channels that they prefer, but patients and practice staff can communicate whether they're at home or on the go. Just the other day, one of our current customers at Klara had actually mentioned, he's a provider. He loved the ability to take more vacations with his family and still be able to answer time-sensitive questions from patients that came in because he just has it right there on his phone. He can just quickly knock those out. So if your patients want to text, your phone lines can be cleared up for those who would rather call in. And then maybe if they'd prefer to talk with you using like web chat directly from your website, or if they want to receive their appointment reminders through email, all of that is possible through Klara. So no matter how your patients choose to communicate, your phone lines will be freed up so your practice can start closing that loop faster, that communication loop faster. Now, Pete, can you give us some examples of how practices you talk to are hoping to use these various communication channels? For example, like millennials versus older patients.
Yeah, for sure. Obviously, the millennial and younger generation is super tech savvy, super text centric. We're finding obviously more and more, depending on the specialty, we definitely see a different mix of patient ages and the willingness or want to speak to and communicate through different forms of communication. And I think just simply providing people the option to choose which method suits them the best is really providing the best level of care we can, and moving a little bit away from being assumptive of the age. What I'm hearing more and more from people, and when you gave an example of that physician, it reminded me of another story we heard recently, Francisco, where we had a provider sign up for Klara because his mother, who was in her mid-70s, had an experience with Klara with her dermatologist, and it typically took her days to get a response, and she told her son, I tried the new texting feature and I got an answer within an hour. So I think that maybe 5 or 10 years ago, there was a much larger gap between, your quote unquote millennials and older demographic, to where now I think that gap is really shortened. And when we do see folks on the other end of life, oftentimes they have family members that are younger that are helping them with their care too. So the ability for those family members to have access to their providers in a more convenient modality, whether it is through a website, chatbot, or through simply picking up the phone and texting. I think the more avenues that you can provide somebody to be able to communicate, they get to choose and kind of create their own path, which naturally, if we get to choose, we tend to adopt that a little bit higher than if we are forced to use something that we may not be, as comfortable with or as familiar with. So I think all the different avenues through being able to leave a voicemail or a text, or if you're on a PC and maybe somebody doesn't have a smartphone, visiting a website where they can chat through the web messenger gives them the opportunity to utilize technology the way it's comfortable for them.
Yeah, that's, and through that, like throughout the entire patient journey even. So we've talked about, how it's easier to connect with, your providers as a patient. And now we can kind of jump into how Klara really does enable your practice to seamlessly connect with patients at each step across their journey. So using our conversational patient engagement platform, practices can streamline those redundant manual tasks that we had kind of talked about earlier and automate or simplify them. So for example, voicemails, now can be sent as a text message, and, covering that response versus playing that game of phone tag, or scheduling, a patient can self-schedule versus having to call in and jamming up those phone lines. Paper can now be collected digitally, like Pete had mentioned earlier, and like things like pre and post visit instructions, right? So ensuring that your patients feel prepared, all of those touch points that we highlight here really can be automated through Klara, and making sure that you're in constant communication, and so on and so forth. So when it comes down to all of these communication channels, how they affect your staff members' processes is really, our goal is a positive impact overall, and that all that communication really is centralized into one patient thread that's visible for anyone on your staff that needs to see it. So like we had mentioned earlier, you have web chat, you have phone calls, you have these text messages, voicemails. All of that is centralized within Klara right into this seamless interface that your staff has access to. So if a patient has a billing question, the billing department, can go ahead and be notified, or if they have a question about medicine they were prescribed, the clinical staff can be notified, and they can go ahead and respond and close that loop faster. So this centralized collaboration across teams and even third parties such as pharmacies, you can invite them to a conversation to connect everyone that's involved in the healthcare journey. It really will improve patient care and unify their experience overall. So to put it simply, Klara helps you simplify your communication processes so that your staff doesn't have to play that internal phone tag, that internal communication game to solve patient problems. Now, Pete, do you have any other thoughts on centralized communication and the results that, practices you talked to experience from it?
Just really briefly, whether the patient or the practice is communicating, generally from the patient side, whether they pick up the phone to call, they text in, they use the website, the web chat messenger, all that communication flows into the same place. So keeping everything in the same place, having those conversations, being able to be accessed and not siloed by anybody at the practice, whether it's a clinician, whether it's a scheduler or biller, even somebody that may be outsourced outside of the organization, makes it really easy to pick up where somebody had left off, really seamlessly. If people take days off, if somebody calls out, having one continual or one thread with continuity that anybody can jump in and answer a question, I think provides a really quick, centralized way to communicate back and forth with the patient. So obviously, the less applications that we can have staff needing to access to communicate, the easier it is on them, and the less likely that something important might slip through the cracks if there are just so many systems to juggle and so many places to look for patient communications throughout the day.
Yeah, absolutely. And like a quick example of kind of how this happens within Klara. As you can see here, Mr. Doe, John Doe, he called his practice and, he's leaving a voicemail stating that he would like to schedule an appointment, but that he does have some questions ahead of time. So when he left this voicemail at the practice, his message was automatically transcribed into his patient conversation thread within Klara. And, Dr. Lovelace is responding. She received the notification of John's message, and she goes ahead and tags Ben, one of her front desk assistants, to call John back and schedule that appointment, and also send him the patient consent form that's needed to be filled out ahead of the appointment overall. Now, where that internal triage can take place is that, Ben is now able to schedule the appointment directly with John and send a text message with the patient consent form for John to digitally fill out prior to his appointment. And while this is just one small example within a patient journey, you can imagine the various ways that practices are able to communicate with patients and their internal staff to improve overall efficiency within that practice. So a look ahead, we'll go ahead and look at some specific examples of how Klara can streamline communication at your practice while we take a look at the interface between Klara and Greenway specifically.
Yeah, thanks, Francesca. And basically, our hyper customizable rules and automations mimic the Greenway Energy practice internal workflows and processes. And as discussed, Klara seamlessly connects patients with providers. Now, we call our automations our Klara Assistant, so aptly named that it is, a replacement for the need for maybe additional FTEs as the practice grows. But we're able to add in our phone integrations, and you have a real true system of engagement used throughout the entire practice that's going to help alleviate a lot of the high call volume and improve the patient experience overall. And here's what that interface looks like. So we do have a strong, robust integration with Greenway to where we can provide these really customizable patient journeys. And here's a deep dive into how these two systems work together. With the interface, practices are able to sync all patients into Klara and manually export critical information back to the EHR. So, for example, it just takes a few clicks to be able to send information that's clinically relevant and document from Klara to the EHR really simply because of the direct integration there. And practices can also use our Klara Assistant to collect paperwork digitally, automate pre- and post-visit instructions by not only appointment type, but also engage no-shows and increase patient retention with follow-up messages and more. For example, a lot of practices have a lot of post-visit touch points to make sure people are healing properly or have gotten the appropriate educational information, whether it's medication adherence instructions, a hyperlink to an additional resource outside of your practice. And the Klara and Greenway interface automates communication across the entire care journey and keeps all the patient information centralized and synchronized.
Yeah, and as we recently discussed, again, no matter how that patient reaches out, whether it's that web messenger, the phone calls, the text message, and more, all that communication is centralized right there within Klara, visible to anybody on your staff that really does need access to that information that Pete had kind of gone over earlier. So kind of shifting the conversation a little to kind of look ahead at the future of communication in healthcare, and more specifically how artificial intelligence, or AI, can help your practice support more patients and improve patient satisfaction overall. Now, before we get started into that section, I do want to address the elephant in the room, which is that it's understandable that some folks might have some reservations or even fears about AI. But when thinking about artificial intelligence, in the healthcare space, it's important to understand that AI shouldn't ever take over the experience or make it more complicated. Rather, it really should enhance the current process that you have in place and make it easier for you to reach your desired outcome. So we have a quote from Dr. Rubin here, mentioned in a Healthcare Finance News article, that he believes everything in healthcare delivery touches some sort of workflow, including patient activities. Therefore, it is through workflows that AI can help improve some of the most critical outcomes, reduce costs, and enhance clinical accuracy. This mention of workflow improvement is what we're focused on building at Klara. And when it comes to two-way communication between a patient and medical practice, we really do want to make sure that all friction is reduced between the patient inquiry and the response from the practice. Now, Pete, based on the conversations that you've had with practices recently, over the years even, have you noticed resistance to adopting various AI technologies?
Definitely. I think it's just because of maybe a lack of information or a lack of understanding of kind of what you had just expressed in the AI is not like a robot that's going to take over. We're not going to bring in 5 robots to start answering the phones in your front office. The intention is never to replace the FTE. It's to make the FTE's life easier and be able to provide a higher level of service. Really, as we see the commercialization of healthcare is really taken off where it is thought of more like a business because there's so many options that people can choose where to get their health care. So I think a good example really is through our machine learning is one of the terms where we're able to route messages based on the context of the message. That simply gets the question to where it needs to go quicker. So the example that I commonly use on my demos, and I see a lot of head nods and agreement is, everybody picks up the phone and they call the phone tree and hit 1 or 0, and they end up talking to the same group of people who can never answer their question, only to be pushed off to another department like a billing department or a nurse triage to do a prescription refill. So that's one example that Klara leverages the machine learning AI to just assist and better route requests to the people, the actual people that can fill those requests. So we're just assisting in getting those requests to people who are more appropriate to answer questions instead of bogging down those same group of people only to be passed along to the other groups that are going to be best to answer those questions.
Yeah, that's exactly right. And I know, kind of like we were talking about some of those fears, we're not trying to remove any position or work at a practice. Rather, we're just trying to make it easier for all of these workflows to seamlessly flow through the practice so that you really can do more with less overall and scale up your operations. And one of the things, to jump into Klara's machine learning and AI capabilities is kind of first and foremost explaining how it works and why it shouldn't be scary, and rather, it does supplement your workflows overall. So early last year, so towards the beginning of 2021, we started analyzing incoming patient text messages and surveying our customers to better understand the reasons behind those messages. For example, if a text message came in that mentioned a fee, we may have asked the staff with like this little pop-up here, if that message related to billing. Now, in the beginning, our system needed to learn, and customer input made that possible. So if someone indicated that we didn't identify the appropriate reason, we asked what the correct category was. And with the feedback from our customers, our machine learning model is able to get better and better over time. In fact, it's still learning because we always want to continuously improve. Now, we were then able to take that same logic and apply it to incoming voicemail messages, right? So now those can be longer. Like, we all know that they can be longer and a little more complex. Sometimes they're gargled messages, cell phone reception is bad. So we really took our time to make sure that we had enough input from our customers to ensure that our reason predictions for those messages were accurate. Now, as you can see, it was and still is a similar flow to collect the feedback. And I say still is because, again, we are still continuously improving that model. But it was the same thing. We would prompt customers and say, hey, does this relate to, test labs and results? And if they gave a thumbs up, then our model learned. If they gave a thumbs down, we would go ahead and then prompt them for the correct category, and they could choose that. So we're really excited to roll this out. Some of the results that we've already seen from that are, these are actually, we have even more to date at this point because I think this is about a month old, but at least 150,000 text message reason predictions have been made with an accuracy rate of 92%. And then for voicemail transcription reason predictions, that's probably north of 140,000 at this point with an accuracy of 91.5%. Now, just to put some of that in context, the patient selected accuracy. So let's say, you have Klara on your website and that little chat message, and a patient's typing in a question, and we prompt them to select the reason so that it can, be routed appropriately to your staff. Only 80% of the time does a patient actually select the appropriate reason. They're probably busy. I know myself personally, I tend to rush through things, multitasking constantly. So I'm probably hitting the wrong message reason overall sometimes. So one of the things that we also wanted to go into is outside of our AI and machine learning model, we want to talk about automation, right? So we had kind of gone through that patient journey and all of the different inflection points that Klara plays and where we can automate some of that patient communication for you. Now, it's important to note that while automated communications were a game changer in the beginning, you may notice that now they're everywhere at this point, in and outside of healthcare, and they don't always feel very human, right? So to make automated messages seem a little bit more personal, let's take a look at a few examples of how to personalize messages within Klara and within your practice's communication workflows. So here's a new patient welcome and insurance card message request. So the first one, very standard, kind of out of the box. Your appointment with my medical practice is coming up on 8/11/2022 at 9 a.m. Please upload your insurance card, and then you can read the full message there by clicking the Klara link. Now, there's nothing wrong with that message. It relays all the information it needs to, and I know I get messages like this pretty often from doctors, for haircut appointments, even like rideshare pickups. I get all these messages. But what would it sound like if we customize the text to make it more personal, right? So, hello, at my medical practice, we know your time is valuable and a fast check-in experience is ideal. That's why you can upload your insurance card ahead of your appointment on 8/11/22 at 9 a.m. right from your phone by using the link below. Thank you. And then you can click to read the full message. Now, all of the same information is provided, but it feels a little more warmer, it's more conversational, and it's less automated overall. Now, again, just more examples of kind of like that standard automated message format. You have a lot of these that are just, your appointment with my medical practice is on this time, press 1 to confirm. All of these things, when you could customize some of them to make them seem more human, provide a better experience for your patient by saying, friendly reminder that your upcoming appointment with Dr. Doe at my medical practice is at 9 a.m. So, just some of the ways that at Klara, we are really trying to make this a better experience for your patients so they feel more comfortable with your practice overall. Now, to sum things up, with Klara, the processes at your practice remain the same, but we can transform them into a seamless journey that allows you to be more hands-off with the redundant day-to-day items without losing that personal level of care. And our goal really is, again, to help you refocus on what you love doing the most, which is the reason you probably got into healthcare, and that's providing patients with an excellent level of care. So I know we've been chatting at you for a while, but I am, I want to remind everyone to go ahead and type in your questions in that Q&A box, because we definitely want to get those answered for you. And I will scroll through a couple right now. Okay, so we have one here. What specialties do we work with? Pete, you want to take that one?
Sure. We work with pretty much every specialty under the sun. There's definitely a lot of the same challenges at all the different practices. I personally, there's been a focus for me on pediatrics, on OBGYN, and orthopedics. And the reasons for that are they're very communication heavy specialties. Obviously, new and expectant mothers have a lot of doctor visits, a lot of labs. So there's a lot of communication, and the same rings true for pediatrics with all the different benchmarks and assessments, whether it's the autism assessment, whether it's the ADHD assessment for the Vanderbilt, and being able to automate that. And just recently I found out that we can not only automate those forms going out, but we can score the forms of assessments as well. So staff doesn't have to calculate all that math. But we do work with everybody from family practice, neurology, cardiology, even your quote unquote like Medicare heavy demographic, because our product is so intuitive and it doesn't require a login credential. It's just everything's done through an SMS text. Even the older folks tend to find it very easy to access and use. So we work with everybody.
Awesome. Yes. Yes, indeed, we do. Another question that came in is from Matt. Biggest question, HIPAA compliance. End-to-end encryption in the non-secure SMS messaging standard. Patient validation to ensure they are who they say they are before release of PHI. Documentation of consent to use this communication platform. All records and conversations being completely auditable. And the elephant in the room is the cost per provider. So I will say, Matt, that unfortunately, cost is not something that we generally get into. It really is something that, one of our AEs can follow up with, understand your practice a little bit better, see how many providers you have, maybe if you're multi-location, and they can go ahead and get you that type of information at that point in time. But in terms of HIPAA compliance, yes, Klara is HIPAA compliant. We are a HIPAA compliant text messaging platform. In terms of encrypting that data, we do have, and whenever there's PHI that is getting relayed on through a text message, that message will be sent as an encrypted text message. And what that means, kind of like in one of the examples that I had shown earlier, we'll provide a link that basically says, you've received a message from my medical practice, click here to view it, so that information isn't exposed right there within their phone. They have to click that link and then go into their Klara app or onto the website to actually see what that PHI is. So we do that. If there are messages that do not have any PHI, those can be sent just as a standard text message. But we do definitely encrypt that because, yes, we are HIPAA compliant. Pete, anything to add there? Otherwise, I'll hop into another question.
Yep. One other thing. We do require that patients confirm date of birth to access that thread as the other factor for authentication and verification of identity. So ownership of the mobile device and confirmation of the demographic information is what we use to identify and make sure that we are, in fact, sending it to the appropriate person, and only that person would be able to access the thread.
Awesome. Thank you for adding that nugget there. Another question that came in is, do you have to use the appointment scheduling function? So no, you do not have to use the scheduling function if you don't want to. So that's something that's completely optional. If you already have something that is taking care of that for you, it's not something, a product that you have to take into consideration. Let's see here. All right, and then another one, does this replace internal Interg tasks? Does staff have to jump between both programs to communicate? So Manuel, go ahead, Pete. I'll let you take that one.
Definitely don't have to juggle between two windows. We actually have a feature that addresses that specifically. We have a Google Chrome attachment that allows you to overlay Klara on top of your EHR window. I will let the Greenway folks answer the task, but I would imagine no, we are not replacing the tasks within Greenway. But our Google Chrome attachment does allow you to operate in both systems within the same window with very little disruption to your day-to-day.
Yep. Yeah, I was chatting with one of our customers probably last month at this point, and that's the exact use case. One of the things that she absolutely loves is that, she can have her EHR window completely open, and then through that Chrome extension, she can click on it whenever she needs, pop Klara over, just does that like kind of half screen overlay, and she can go ahead and talk to a patient while she's looking at their chart and vice versa. So it's really, really nice. And then I will get to...
Hey, I'm on another call.
Oh, okay.
But I have to hop back over.
Well, I think we have some interference, but I will go back into the questions. Can this communication be limited to a certain population of patients? So let's see here. I want to make sure I'm understanding the question correctly. If you initiate the conversation, you don't have to send a message to everyone if you don't want. Now, if you have some of those automated like patient communication steps in place, that would go out based on the criteria that you set with your customer success manager. So let's say it's an appointment reminder that goes out 3 days prior. Anybody that does have an appointment coming up within the next 3 days would receive that automated communication I hope I answered that correctly, but please type in the chat if we need to dig into that further. Let's see here. Does it understand and respond in Spanish? So Martha, we do have some Spanish, like some Spanish translation for some of our messages, not all though. So that is definitely something that we can submit as product feedback. I think we have in the past to make Klara more like multilingual. And then let's see here. Does the Chrome extension allow the chat to interface into Intergy as a task? Let's see here. So Pete, correct me if I'm wrong, but I do not believe that our Chrome extension allows the chat to interface as a task.
It doesn't it won't populate a new task. You can't generate a task from Klara. What you can do is export the information from Klara to Greenway. You can also copy and paste directly from the Chrome extension. You can download files and drag and drop into different windows. So it's not creating or populating a new task, but we can certainly really seamlessly export the information into a task within Greenway.
Yep, awesome. And then another question, so does this replace the Greenway patient portal? So what I will say about the patient portal is that we don't replace the patient portal, right? That's Greenway's and it's awesome. But our platform is a great supplement to it. So patient portals on average, you can usually see about a 20 to 30% adoption rate for patients. Now, when you supplement that with Klara, Klara's patient adoption rate is about north of 85%, so very high adoption rate. So, you know, the majority of your patients will definitely utilize, you know, Klara as their primary source of you know, communicating with their practice. But for those 20% that really do like the patient portal, obviously, you know, this is something that does supplement the Greenway patient portal. Okay, let's see here.
I see a bunch of questions. I'm sorry, Francesca. Yeah. I saw like three questions in a row, all referring to broadcast. So it might be good just to give a little like general outline of the broadcast feature. I saw one regarding inclement weather closing, and that's the example that I always give. So our broadcast feature allows you to send a bulk message to a group of patients with just a few clicks. So instead of sending individual messages, you're able to upload a list of patients and send an inclement weather closing. I saw another use case, which is another one that I mentioned for sure, with diagnosis-based broadcast. So if you can, identify a patient population for, say, an overdue screening or an annual overdue visit, you can certainly use that broadcast feature to send that group of people a similar message as well, and they go out individually, obviously, and you can create a template for that within Klara, so that it can be reused over and over again, so that you don't have to create that messaging every single time. Yeah,
absolutely. And then to supplement that, another one of our features, Zena, is that we have, out of office hours, so like after hours message that can be automatically sent to patients. Let's say your practice hours are from, 8 to 6, and a patient texts in at, 8:30 at night that night. They can be sent an automated message that says, hey, like the practice is closed right now. If this is an emergency, please call 911. Otherwise we will definitely get to your question as soon as possible, on our next business day, something like that. We also have, like vacation hours that can be set. Let's say, for holidays that you're going to be closed. So that, again, those automated messages can just send right out, and there's no gap in communication there, so patients are always informed. All right. I know we are coming up. It's about 12:45, so I do want to be mindful of everyone's time. Any questions that we did not get to immediately, we will definitely go ahead and make sure that those are followed up with. But I just want to let everyone know, if you have other questions, you want to talk to somebody, I know people had a lot of questions about pricing, you can email us at hello@klara.com. You can also go to www.klara.com and go ahead and book a demo, book a consultation, and one of our experts, hopefully you get Pete, we'll be happy to chat with you.
All right. Well, thank you.
I was going to say that don't be afraid of the demo. We can keep it under a half an hour so we don't kill a lot of your day, and run through and answer any questions really quickly.
Sounds good. Well, thank you, Francesca and Pete, and everyone that joined us today. Please take a few moments to complete the survey, which will pop up on your screen momentarily after the webinar ends. Your feedback from these surveys help us plan future sessions so we can continue to deliver content that's meaningful to your practice. And we will make the recording and presentation slides available to your practice via My Greenway after the presentation is finished. With that, we've reached the end of today's webinar, and we hope to see you soon. Have a wonderful rest of your day.
Awesome. Thank you, everyone.